Random testing will resume tomorrow, June 9th, in LaSalle at the Vollmer Culture and Recreational Complex, 2121 Laurier Drive, from 10 a.m. to 4 p.m. We would like to take this opportunity to thank the town of LaSalle for their help in coordinating this testing. Testing will continue Wednesday in Lakeshore and Thursday in Leamington. Any resident of Windsor-Essex County 12 years of age or older can be tested. People will need to provide their health card number, first and last name, date of birth, and address. Please check the Ministry of Health's online portal or the link on our website to access your test results. Mass testing in the agri-food sector will begin tomorrow in collaboration with local hospitals, EMS, OMAFRA, and Ontario Health. I will now share the most current case counts. There are 95,699 confirmed cases of COVID-19 in Canada and 30,617 cases in Ontario. Chatham-Kent has 148 cases, and Sarnia-Lambton has reported 270 cases. Michigan now has 58,870 cases, with 11,196 cases being in Detroit. Today, we are reporting 1,023 cases of COVID-19 in our community, an increase of 9 cases from yesterday. To our healthcare workers, to our workers in the agri-farm sector, to our community cases, and 3 cases are pending further investigation at this time. 577 cases have now resolved. 3 people are in the hospital. 19% of our overall cases are between the ages of 20 and 29 years, 18% are between the ages of 30 and 39 years, and 16% of the cases are between the ages of 40 and 49 years. 49% of our cases are male, 50% are female, and 1% is unknown. Our community has lost a total of 67 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are currently no COVID-19 outbreaks in long-term care homes. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. This week, we will be reducing our Facebook Live sessions to 3 days. Our next session will be on Wednesday and then Friday. Starting next week, the WECHU will be moving to weekly Facebook Live COVID-19 updates on Fridays. This new weekly live broadcast will continue to include our weekly EPI summary presented by Dr. Ahmed. Critical information will continue to be shared with the community through the media, social media, and for those who subscribe to emails from us. We will continue to post our numbers related to COVID-19 on the website on a daily basis for the near future. These daily briefings have been an important part of WECHU's goal to keep our community updated and informed in the rapidly changing landscape of the COVID-19 pandemic. We started these updates on Monday, March 16th, and they've evolved and improved over time. As we are now firmly in phase 1 of reopening the economy and public health updates and new information has slowed, the health unit also needs to adjust to this new normal. Weekly updates will continue to allow us to bring new public health COVID-19 related information to the community and present the data and evidence of what is occurring over time. We want to especially thank everyone who watched these daily broadcasts and shared their appreciation for the great work our staff continue to do during this pandemic. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning and thank you for joining us. Over the weekend, the Windsor-Essex County Health Unit confirmed an additional 24 cases of COVID-19, including 9 new cases for today. As was reported on Saturday, there was another death of a male in his 20s. This individual had significant health condition that led him to seek healthcare in early May, where he was also diagnosed positive for COVID. He required hospitalization and then recovered, and was later considered resolved for COVID-19. Unfortunately, he developed severe symptoms again and was later admitted to the hospital and passed. It is extremely tragic to report the loss of someone so young. I extend my sincere sympathies to the family of this young man. Today, I also want to talk about vaccines. Vaccines are a proven and safe way to prevent serious infections. While there is not yet a vaccine for COVID-19, there are many vaccines available to protect you and those around you from other important infectious diseases. Some of them more infectious and deadly compared to COVID-19 and can cause severe health conditions in many individuals. Most of these vaccines are part of routine immunization for children and are a priority, especially for children 2 years of age and younger. And all these vaccinations should be kept up to date to protect your children and everyone around them. Any omission or delay in scheduled vaccines can put your child at risk for common and serious childhood infections such as pneumococcal disease, measles, mumps, rubella, pertussis. These required vaccines should only be postponed if a child is sick. Unvaccinated children and community could potentially lead to an outbreak of any of these diseases. In Ontario, your child's pediatrician, family doctor, or a nurse practitioner or a walk-in clinic can provide immunization. Parents of infants and toddlers should review the schedule of required immunization and contact their healthcare provider to make an appointment if they're behind. If you have a child in grade 7 or 8 that was to receive their vaccines through the school-based immunization clinic, you can visit your healthcare provider to receive these vaccinations. The Windsor-Essex County Health Unit advised that you obtain your child's up-to-date immunization record from visiting our website immune.wechu.org and take it to your appointment. If you are unable to reach your healthcare provider, please call the WECHU at 519-258-2146 extension 1222 and we will work to connect you a provider in a community. After your appointment, do not forget to update your child's record at immune.wechu.org or by calling the health unit. School-based vaccines administered in grades 7 and 8 includes Menactra, hepatitis B, and Gardasil 9. The Windsor-Essex County Health Unit is advising local healthcare providers to contact the health unit to order these vaccines for their clinic. Vaccine orders can be placed Monday to Friday from 8:30 to 4:30 p.m. It is critical that children continue to receive their routine immunizations. Diseases like meningitis and measles can have devastating impacts and are preventable. Through this new collaboration, publicly funded vaccination will be available for and delivered by local healthcare providers in our community. Thank you.
We'll now take questions from the media.
Yeah, we'll start with the Windsor Star.
Yes, Doctor. I just want to be clear. I may not have understood the timeline for the 24-year-old who passed away most recently. You said he tested positive and had been considered recovered, but then his condition worsened again. Was that within the 14-day period?
No, it was after the 14 days period, and anyone after the 14 days period, if their symptoms are resolved, and based on the criteria for clearing those cases, we consider them as resolved. So from our perspective, he was resolved, and he had significant underlying health condition, which led him to seek health care again, and unfortunately, he lost his life to a combination of everything that he is experiencing.
But we still consider that COVID-19 created those complications with his underlying conditions?
It would be hard to say, but the way we are reporting and the ministry is asking us to report, we classify it under COVID, but it would be hard to differentiate what caused it. But simply to say his significant underlying health condition was a concern on its own, and having a diagnosis of COVID, a combination of those two could have led to it, but it would be hard to say which caused what.
Thank you.
Any questions from CBC?
Not right now, thank you.
Any questions from Blackburn?
Yes, now that the outbreak has cleared at Heron Terrace, have those residents that were in the field hospital, have they been moved back to Heron Terrace?
I would defer this question to Heron Terrace and the field hospital to get a most up-to-date status, but my understanding was they were supposed to move. I cannot confirm what's the plan for repatriation. Heron Terrace and the field hospital can comment on it.
Any questions from CTV?
I was going to ask you for an update on the field hospital now that this is happening, but I'm guessing you're going to defer to the hospital on that one. Yeah. I can smell that coming. Sorry. I probably shouldn't have said anything, but
It's good if we stay in our lane and answer the question that we can answer confidently and accurately. Yeah.
Any questions from AMA 100?
Yeah, could you just expand a little bit on the decision to start reducing the number of, Facebook Lives and all that stuff that you're doing? Is this because we're starting to hopefully move into stage 2, or what's the reason for the reduction in news conferences?
So it's a combination of all, as you mentioned. It's obviously there's not a lot of changes that are coming down from the ministry as quickly as it used to be in the past. Also, with the new changes, with some of these reopening, there's been more attention to study those effects and then make sure that we have everything in place to serve our community in the best possible way, and also to share information when it's relevant. So we are committed to share any important information that is coming our way, and me and my team will make ourselves available for any of those concerns in the community. The daily updates with respect to the number of cases and some of the other issues that are ongoing will continue to happen exactly the same way as it happens. The only difference it would be that we won't be having these Facebook Live sessions, but all the other information will be continued to share. And we are available, me and my team, to answer and address any evolving situation or any immediate concerns in the community.
Okay, and so, knock on wood, if things were to do a bit of a turnaround here and, we see that second wave or something like that and cases started going up again, would you be open to resuming, the daily updates via Facebook Live and whatnot?
Absolutely, and I think this is what our commitment is. And even when it all started, we never used to do this type of Facebook Lives, but we felt that it's an important thing that's needed in the community, and things change. So this is the plan for now. If there's any changes that happens, maybe today, tomorrow, or whenever, we'll go back to seeing what the community needs are and how we can best address those community needs. And if it means that we have to come back to Facebook Live every day, we'll come back. I think it's just trying to work with the needs and also balancing what needs to be done.
Okay, thank you.
Any questions from Windsorite?
I'm okay, thanks.
Any further questions from the Windsor Star?
In terms of children staying up to date on their vaccines, do you perceive a lot of kids are going to be behind because of what's been going on?
That is what our understanding is. We have received concerns from the community, some parents unable to get their vaccines, and obviously there are many healthcare providers who services were not open. So we are starting this initiative working with our community providers to make sure that some of these measures are in place to provide the vaccines. We talk about COVID-19 all the time, and we talk about vaccines, but we also shouldn't forget that there are other significant infectious diseases that exist in this world, and fortunately we have vaccines available for them. So we should be staying on top of the things that we can, and we're happy to see that we have some of these new initiatives in place in collaboration with the healthcare partners to make it available for the residents of Windsor-Essex.